COVID-19 has put immense pressure on our NHS. Never has it been more important to free up hospital beds. And here in Somerset, a programme that's already received national recognition is helping people to get back to their own homes faster than ever before. The terms reablement and discharge to assess, D2A for short, are perhaps unfamiliar to most of us. But these industry terms have a simple and important aim, and that is to get people back on their feet and living independently as quickly as possible. And now, most of the work to achieve that is done not in places like this or in community hospitals, but in your own home, with a package of support like never before.
It needs to be moved, doesn't it? There we go. Other one.
Susan is an example of reablement in action. She's been in and out of hospital since last November, among other things, with coronavirus. When she came home in February, she still needed a full hoist to move from A to B. But the progress she's made since, with help under the reablement scheme, has been remarkable.
It's doing really well. I can't believe how I've just gone from one thing to another.
How important has it been for you to have your rehab at home?
At home, very.
If our service wasn't have been available, Susan would have been needing to go into a bedded rehab facility to achieve the goals where she would then be manageable at home with the existing care package that she already had in place.
It's clear that the 6 weeks of support in her home has been key to the speed and extent of Susan's recovery, achieving the goals that she set.
This is about a difference. It's about sitting with you, working out what is it that you want to achieve to get you back to where you were, or even how is it going to help you to continue to go out? What are the things that you need that'll help you to be as able as you can back to whatever you were doing before and to live the best life you can?
The scheme is already achieving notable successes. Over the last year, more than 3,300 patients have been helped to get back home quickly after hospital stays, freeing up more than 20,000 bed days across the county, desperately needed during this pandemic. And that's so important when you consider that a 2018 review in Somerset called Fit for My Future revealed that a 10-day stay in hospital can have the effect of up to 10 years of ageing. A third of people over 70 experienced loss of independence and functionality during a hospital stay. And 38% of those in hospital beds could have been cared for elsewhere. How good are we at it then in Somerset? Be honest, are we a beacon?
We absolutely are a beacon, and we are nationally recognised as one of the best systems in the country. And that's credit to a lot of things. It's credit to the amount of work that we've put in to help people. But more importantly, it's credit to the fact that we're not just looking at the data, we're looking at outcomes for people. And those outcomes that people want to achieve are being achieved. And that's because we work as a system. We don't worry whether it's health, whether it's social care, whether it's our voluntary sector delivering. We are a team that is passionate and really wants to help people to be the best that they can be, to be as independent as possible in their own homes and in their local communities.
The pandemic has, of course, changed the way we all live and work. But putting in an immediate package of help and support at home following a hospital stay, helping you to help yourself return to independent living while at the same time freeing up hospital beds, is a way of working in Somerset that is here to stay. I'll see you next week.